Hello, my name is Dr. Robert Tracy. I'm a family physician that practices in Northern Kentucky for the past 30 years. I'm also the medical director of quality for St. Elizabeth Physicians. Today, I'm going to talk to you about the impact of COVID on our HPV vaccinations, as well as other care gaps and how we strategize to improve our vaccination rates. A lot of this work could not have been done without the help of my clinical transformation team, the valuable work that the RNs and LPNs did. So St. Elizabeth Physicians is a large multi-dynamic, multi-specialty group. It has about 700 providers. We are in 3 states. We service 14 counties and about 364,000 patients. In 2020, we did nearly 1.6 million visits. We have 41 specialties and 59 practice locations. So in 2017 is when we really started looking at HPV and our vaccination rates. In the state of Kentucky, unfortunately, we have some of the highest cancer rates in the nation, largely due to our tobacco use, coal mining, and obesity rates. Our organization started looking at what we could do as interventions. And one of the things we learned is that we had the highest oral cancer rate in the nation, largely due to HPV. So we started looking at this, and when we looked at our vaccination rates, we realized that for 13 and under, we were only vaccinating 20.4%. So we needed to create an intervention, and this is really what spurred our campaign to improve HPV vaccination for our younger population. It became a quality focus in 2017, and in order to improve our vaccination rates, we had to start from the top down. So we created learning modules for our providers. We needed to educate them that this was a vaccine that prevented various cancers, and we needed to help the providers to reframe their conversations with their patients. This also required education and learning modules for our clinical staff. We understand the importance of that relationship between the medical assistants and the patients, and often some of those vital conversations are carried out in the room with the staff and the parents and the patients. We challenged the offices and we put together ice cream socials for those offices that had the highest success rate in completing these. We had to redirect the whole conversation as an anti-cancer vaccine and not a sexually transmitted infection vaccine. And finally, we created community awareness with educational campaigns, and we partnered with some of the local media on TV that had health spots, and we used social media in the form of Facebook in order to get the message out about the vaccine. As you can see from this slide, we had a very good success rate. So in 2017, we were at 20.4, and by 2020, we were up to 52.4%. In 2022, you can see our numbers started dropping again. So we made adolescent immunization an organizational strategic objective. One of the ways that we accomplished this was something that we had instituted prior to the pandemic, which was weekend wellness events. The events targeted care gap closures for patients. We held them on Saturdays from 8 to 12. That was more convenient for families. And as I said, we targeted care gaps such as in diabetes. We did cancer screenings. We had a mammogram van there at the site. We scheduled patients for low-dose CT scannings, and we had discussions on options for colorectal screening. We did vaccinations all the way from adolescents up to seniors. We did blood pressure checks. And these were very effective, and they were well received by the patients. Unfortunately, with the pandemic, we had to shut down our weekend wellness clinics, so we had to rethink the process on how we could reach out to our patients. So we came up with drive-through clinics. In 2020, we vaccinated 646 patients, primarily influenza, but we also did other vaccines if needed. We did it at 6 sites. The way we did our outreach was through a manual Epic MyChart message. We did flyers, and we also did postcards, which was quite expensive, and we only did it for 1 year. In 2021, we redid these same clinics. and we reached out to 738 patients. I have to say that the patients were very grateful, very appreciative of this. They liked the fact that this was very quick, convenient, and safe for them to do. In 2022, we've already completed 2 of our clinics, and we've changed some of the ways that we've reached out to patients, and this is probably an important message to take back. So we now have over 1,600 patients scheduled, and what we did is we leveraged a tool that we had not previously done, and this tool was EMR MyChart bulk outreach functionality. In the past, we had to do these manually. It took a lot of time, a lot of staff, but now, as you can see, we reached out to over 100,000 patients, and really 1 or 2 personnel can do this. One word of caution though, the first day that we did this, we nearly broke our EMR because we sent out all these messages, patients got them all at the same time, and they all logged into their MyChart, and it actually took the system down for a short period of time. So now what we do is we send it out to 2 to 3 practices at a time, about 10,000 patients, and we would just every day do another practice. But we really only had 1 person that was sending these messages out. And as you can see, our response rate is pretty significant. We've actually had to close some clinics because we've had so many people scheduled. So we took this same concept for HPV, and in 2021, we did an adolescent immunization drive-through clinic. So we used our population health support service team, and they did outreaches. You can see about 3,000, and their goal was either to schedule people at the drive-through clinic or for well child visits. And we did get 82 people scheduled, and we scheduled 573 office visits, which we thought was pretty successful. So the results of our adolescent immunization clinic on 2021, as you can see, we vaccinated 31 children. We did have a fairly high no-show rate of 57%, but we did learn several lessons from this clinic. Number one, the timing. One of the things is 8 to 12, which we use for our traditional influenza clinics, is probably not very conducive to adolescents as they like to sleep in. Another issue was probably needing to do reminder calls for those that actually scheduled for the clinics. And then second, we realized that we're working against this buy-in from the parents. In the state of Kentucky, HPV is not a required vaccine. And so we have a lot of work to continue to convince parents that this is important. In 2022, again, we wanted to do the adolescent immunization drive-through. So in May, we did a targeted outreach. And again, we did phone calls for this. We did about 1,500. We scheduled 378 visits. And we had about 17 patients scheduled for the drive-through alone. Initially, we targeted 15 and under, and we looked at people that or patients that had at least 1 HPV vaccine done because we felt like they were more likely to buy into completing the series. And as you can see, we did a total manual Epic MyChart outreaches of about 7,000. So a lot, it was very labor intensive. Ultimately, we ended up canceling because we had a poor response rate. We have learned over time we need about 30 patients in order to break even for these clinics. Most of our drive-through vaccine clinics are always break even or a little bit profitable due to the charge for the vaccine and administrative costs. Moving forward, we're looking at ways to improve our HPV vaccination rate. One of their goals is to partner with our virtual health department that currently provides school-based acute care delivery to nearly 76 schools in the Northern Kentucky region. We're going to leverage the MyChart bulk messaging to try to reach out to the maximum number of patients. And as you see, we're targeting to do this in the spring when students are still in school because I think we'll get better engagement. Also, springtime, there is less demand on vaccination for influenza and other vaccines. So hopefully from the lessons we've learned previously, we can improve our rates. Most importantly, we are going to maintain adolescent immunization as a metric on our organizational strategic objective for 2023, so it's foremost in our minds and we don't lose sight of this. I hope this information is helpful in improving your vaccination rates, and you've learned from some of our trials and errors, and I'm more than happy to answer any questions that you have in the Q&A section. Thank you very much.